So the most common patients that walk in to an ophthalmology clinic anywhere in terms of medical problems will be things like eyeglass prescriptions, right? Which often they'll go to an optometrist, but sometimes they'll come to an ophthalmologist because they can't figure out what's wrong. Cataracts are the biggest surgical a problem that we see. Everybody's going to develop cataracts if they live long enough, so we're going to see every person in this population at some point in their lives. And then what they'll come in with is usually blurred vision. All of these patients will come in with blurred vision. Sometimes they'll come in with eye pain, and those are different conditions. So sometimes my patients who need corneal transplants will develop blisters on the surface of their eye, or they develop ulcers from wearing their contact lenses and not being very careful. And so that's the other thing I always tell my students: make sure you clean your contact lenses well. Don't swim in them, don't shower in them, because we, especially in Florida, see a lot of corneal ulcers which need corneal transplants. So they'll come in with eye pain or blurred vision. Those are the two big problems they'll come in with. So cataracts, corneal problems, they'll come in with glaucoma. And often the glaucoma patients are not coming in with glaucoma. They come in for a routine eye exam, and it's picked up that they have glaucoma. So glaucoma is sort of one of the silent killers. It's like hypertension. People don't know they have it until it's too late. So a typical patient visit will entail, first they'll see an ophthalmic technician. So these are specialized people who've been trained to do eye exams. So they'll typically check the patient's vision, the eye pressure, they'll dilate the pupils if needed, they'll check for glasses sometimes. And then the ophthalmologist will come in and they'll talk to the patient, find out what the problems are, and then examine both the front and often the back of the eye. And the nice thing about ophthalmology is you can actually see what's wrong, right on the surface. And so we'll examine them on what's called a slit lamp, and that's what every ophthalmologist will own. And then typically, the majority of my time is actually spent counseling patients. So you explain to them what's going on with them and what you're planning to do about it, and what the risks and benefits of each thing are. And that's typical for medical specialties or surgical specialties, period. And then most patients will come in, for the whole spectrum of eye problems. So patients that I see in my office, for example, will be the whole range from people who've come off because they can't see very well, they want that change in their glasses, to sometimes patients who, since I'm a cornea specialist in an academic center, have seen 3 or 4 other cornea specialists. They've had multiple surgeries and nobody can help them, and they come in as sort of the last ditch effort. And then everything in between, where they've got corneal problems or cataract problems or complaints that they don't know whether they're related to the eyes or not. They have a headache and they can't determine whether that's because they have a head problem or an eye problem, and so that's part of the workup. So that's the other cool part about ophthalmology, is the collaborations you do with pretty much every part of medicine, right? So we touch every other aspect of medicine, primarily medical specialties. So we do a lot of pediatrics. So a lot of children get sent to us who have failed their vision screenings. We get people with inherited problems when they're children that we can sometimes fix, sometimes not. And now with the gene therapy, we can fix things that we couldn't fix earlier. So lots of pediatrics, lots of internal medicine, because we see people with diabetes, with hypertension. They can both cause problems in the eyes. And sometimes we can diagnose problems in the eyes before they develop them systemically. So for example, diabetic patients will get their eye problems and start bleeding in the eye before they lose their kidneys. So if you see them develop retinopathy, you can warn them you are developing nephropathy and maybe save their lives. Same thing with hypertension. You can see the hardening of the arteries directly on the surface of the retina, and you might save them from a heart attack. So lots of collaborations with medicine and pediatrics. But emergency medicine, they see a lot of the emergencies that are ophthalmology related. Lots of trauma is related to the eyes. When you have a motor vehicle accident, we always go and check out the eyes, even if they've got any fractures. So we get to work with almost everybody in medicine.